what we want. So happy with that. And he should obviously just pop in at some point. I don't know whether he'll come in and he's in a waiting room or you know how to YouTube, don't you?
I'll just move around and get a shot of him actually talking with the guy on the screen.
Are you recording now?
Yeah.
Good. But that's
good. Yeah. Okay.
No, just those
pause that.
I guess. Yeah.
Right, so just from your experience, obviously Virgil Van Dijk has apparently, well, reportedly had a grade 3 tear in his ACL.
Yeah.
From your experience, how long is that on the sidelines, and what does he have to do to recover from that?
I mean, the first, grade 3 just means completely torn. So, I mean, that just means in non-medical terms, if that's what he has got, he's torn his ACL. And as I say, Liverpool haven't announced he's torn his ACL. I mean, 2 and 2 kind of makes 4, kind of suggests what he's done. But if he has torn his ACL, then he will need an operation. So Liverpool have said he's having an operation. So that would generally sound like he's going to have an ACL reconstruction, which is dead common. So there's plenty of footballers around the Premier League and all the lower clubs and all the Sunday League clubs who have their ACL reconstructed. So if he has that, he will have that wherever. And then he will go through a rehab program like all the other guys doing ACL reconstructions. And generally, if that's what he's had, then normally 6 to 9 months. That's a ballpark figure before he's back playing, which as a Liverpool fan is horrendous.
Yeah, I agree.
Are you a Liverpool fan?
Yeah, I am, unfortunately.
Yeah, no, it hurts. It hurts a lot.
Yeah, from the mental side of things as well, obviously being at the top of your game at 28 and 29, having that injury, from your experiences, how much is people mentally affected by having such a bad injury?
It affects people differently. So often the mental side is more difficult than the physical side because, everything I've read says, he's up for it. It's a challenge, and he'll confront that challenge just like he would any other challenge in his life, whether it's a Premier League run or a Champions League run. So having treated professional athletes, I just say, this is your next goal. So, if at the start of the season, your goal is that you want to win the Premier League or you want to win the Champions League or you want to, if you're not in the first team, you want to get in the first team or all of those type of things, you just have to shift your goalpost now. And this is just another goal. And your goal now is to get back fit so that you then get back playing for Liverpool and doing all the things that you were doing before. So they just have to completely shift their focus. Most professional sportsmen are easily strong enough to recover from it, generally because mentally most of them are pretty strong because they've got to where they are with that anyway, with the determination to be a professional sportsman playing any sport. And obviously, Liverpool have huge medical backup with physios and doctors and everyone to then, allow him to recover. So the great majority of professional sportsmen injuring their ACL. And the other thing to say about an ACL tear is that obviously inside the knee, there's lots of structures. So if he's torn his ACL, then has he torn any other ligament? So has he torn, the second one would be what's called the MCL, which is the second commonest injured at the same time, which again, footballers have all the time. So most people who are non-medical roll MCL off their tongue because they read about it in the papers and from you guys reporting on it. So has he done that as well? Has he damaged his, what we call menisci, which are the cartilages, which are the shock absorbers in the knee? Has he damaged the lining of the joint? So there's a whole host of other things which will play a part in his rehabilitation and his ability to get back to playing like he did before. But mentally, he'll take it on, I suspect, as a challenge, just like he would any physical challenge. And there'll be big downs, if he has torn his ACL and he's having a reconstruction, that's kind of season over as defending champions and trying to get the Champions League back and everything else. And, he's got the Euros next summer for Holland. That might be a realistic aim for him post-season. But they'll set goals. And the first goal now is to have his operation, if that's what he's having. And then it will be to physically recover from the operation without a complication. And then throughout his rehab, he will have milestones and goals, which his rehab team with the physios will say, right, this is where we want you in 2 weeks, this is where we want you in 4 weeks. And that will kind of change as things happen. But yeah, it's just setting new goals related to injury. Timing wise is very, very difficult. And certainly as a surgeon, I try not to give times to patients or clubs because you can just be made to look a bit of a Charlie, really, by getting your times wrong. And they'll discuss that with his rehab team. But realistically, you know, with an ACL reconstruction, no one's getting back before 6 months, even with modern techniques and stuff like that. And depending on how he does, somewhere between 6 and 9, which, as I say, from the middle of October would take him pretty much to the end of the season.
Yeah, just finally, how important is it for him that he's got people around him that have been through similar injuries? Obviously, Joe Gomez had something similar. Alex Oxlade-Chamberlain had something similar 2 years ago.
Yeah, I mean, I think that's a good positive for him because obviously, you know, they're back and they're playing, you know, and they're good. You know, Danny Ings did it as well. You know, right up there at the moment. So, yeah, I mean, he'll have his family, he'll have his friends if he can see them in these crazy COVID times. But he'll probably be zooming like we are, and he will. He'll probably be not in a great place at the moment. Just like anyone who's injured, whether it's, you know, a pulled hamstring or anything, you know, players don't want to be injured, but it is part of the game. And he'll have a bit of a dip, and then, you know, I suspect just like he throws himself into his football and being, you know, what he is, he'll do exactly the same with rehab, and should hopefully then come back the same player. But it takes time, and it'll be tough for him. He's got to watch his teammates playing and hopefully winning. And he's stuck on the sidelines, which is never where they want to be. But yeah, I think, you know, other people who've had it will tell him, look, this is what I experienced and this is what got me through it. And whether it's Xbox or PlayStation, or there's no point saying learning a language to a Dutch person because they normally speak about 5 languages anyway, but something, because actually, you know, being in a gym is dull, really, really dull. And it doesn't get much duller than knee rehab. I think it's about the most dull rehab of any rehab that they do. And it's slow and boring. So he needs to have something to occupy his mind and get him through it. But yeah, there's a very reasonable chance he will, just like all the other players. It's just tough. Just
going on from what you said then in regards to the actual rehab, can you go into details of what you've done in the past to help, you know, people, you know, get back to what they want to be?
Yeah, I think a lot of it is setting goals, appreciating that there is a physical and psychological element, and that it is not just about, you know, measuring muscle strength or wobbling their knee or whether they've got fluid in the knee or something, and assessing the patient as a whole. And actually, you know, a lot of these players carry little niggles, particularly some of the younger players you treat, and it is a chance to say, now, a lot of the times they come back stronger, physically stronger, because they've had a year of doing rehab rather than playing football. Now, I'm not sure you can get any stronger than Virgil Van Dijk, but, you know, I suspect, you know, you never know what these players are carrying. So, you know, within any changing room at the start of the game, if you said, right, anyone who feels 100% fit, put your hand up, there won't be any hands going up, because normally someone will have a bit of an ankle strain, bit of a sore hammy, bit of a sore quad, bit of something, bit of a groin problem. So a lot of these players kind of have a rehab and bespoke training program anyway to get them on the pitch in the first place. And sometimes you may say, right, this is the time actually where we can really hone in on a minor problem that you had before and try and sort that out. So, you know, a lot of players do feel, particularly the younger ones, I'm not sure so much at 29, but a lot of the young ones, the 17 and 18-year-olds, do come back feeling that they're a stronger player because they've actually gone in the gym, because some players go into the gym more than others. Some like it, others hate it. And actually, he's got to go in the gym. That's where he's going to be for a long time now. So I say mainly for the younger players, but it's all very psychological talk. But they've got to say, right, this has happened. As he's already said, I heard him say a quote, you know, no one wants to get injured, but it happens. It's part of the game. And you've got to look for positives from it and say, okay, what can I do now for the next 6 to 9 months to mean that when I come back, I'm a better player than I was when stopped. And there is the chance for that purely with rehab. So I'm sure that's what he'll be looking at, because you know, he comes across as, I've never met him, but he comes across as a pretty positive guy, and I suspect he'll focus on it and get through it and hopefully come back better and help us win some more trophies.
Wait there, let me just